There's a big push around the world to find a vaccine, but there are fears a rushed solution could bring on side effects and provide fuel for anti-vaxxers. Crystal Goomansingh breaks down the complexity of creating a new vaccine.
Billions of people are locked in their homes, one of the few rudimentary protections we have against a virus that's infecting and killing people at a record pace. It's this microscopic ball-like structure with its spikes that scientists are racing to decipher and defeat.
How the virus actually docks and then fuses with the membrane, uncoats, and then delivers its payload. And it's that whole viral life cycle that we try to understand.
Jonathan Heaney is a Canadian scientist working at Cambridge University. His team is one of more than 40 registered with the World Health Organization pursuing a vaccine for COVID-19, even though we still know very little about the disease.
Vaccines for coronaviruses have a very, very spotted history. In fact, it's very, very difficult to get an effective vaccine for coronaviruses.
SARS and MERS are in the same viral family. They don't have vaccines yet either. A paper published in the official journal of the National Academy of Sciences highlighted past pitfalls that caused the immune system to backfire. One of the side effects? Antibody-dependent enhancement. Essentially, the body makes it easier for the virus to invade. Officials in Ottawa said safety is the priority.
We don't want to be vaccinating people and making it worse. And there are a number of adverse outcomes that can happen if you move too quickly.
Any severe safety issues will immediately trigger a review of that trial.
But in the race to find a vaccine, regular drug testing steps are being combined, and work is progressing faster than ever. Vaccines in general are big money makers. A vaccine during a pandemic would be huge. Heaney doesn't want anything overlooked in the rush to get a product to market which could feed the anti-vax movement.
Our fear is that we'll get these nasty side effects and the public will get the impression that these are dangerous vaccines.
As death tolls rise, people may become more accepting of risks associated with vaccines, but scientists like Heaney are calling for more worldwide collaboration and cautioning time is a necessity to get it right. Crystal Goomansingh, Global News, London.
Leaders of all kinds are playing a huge role in the response to COVID-19. And in Canada, many of the key leaders are doctors who happen to be women. That's inspiring people across the country to find ways to honor these public health heroes.
Based on the information available, cases are all.
There's Teresa Tam, Canada's public health officer.
And there's a rationale for why we would.
Bonnie Henry, BC's medical officer of health.
This is not an overreaction.
Dina Henshaw, in charge of the health of Albertans. They're doctors who deliver the disconcerting details about a virus that's taking lives. And they're all women leading the charge. That inspired a Calgary artist and an entrepreneur to put their faces on T-shirts to raise money for food banks. They swiftly sold out.
These are women who are in science, and it's about them being able to exercise their leadership in a time where we need that real combination of both data and science, but also this caring compassion that they seem to manage to tie together.
Dear Dr. Bonnie, what to say to you?
Two Vancouver roommates, Amy Shire and Vicki Henderson, wrote a song devoted to BC's medical officer of health.
They're all so qualified and competent and calm, and they're giving you real information and factual information.
So by way of update?
In Toronto, that city's public health officer is being honored in a unique way, with a Twitter account for the scarves she wears daily, proving their style and substance.
How many scarves do you have?
I'm not sure.
These women certainly didn't have a following weeks ago.
Now we know their names and we know who they are and we can recognize them.
Yeah. You have nice eyes and we just learned your name.
Now they're front and center, not looking for stardom, but a solution to this crisis.